Good morning, CNA class. I'm doing this review via camera, and I will figure out a way to download it to you so that if you can't make it today for the review, then you can at least watch this. I'm sorry, you have to endure my mug. I guess this is my one shot in being in the movies, but it's nothing. Don't get paid extra for this, so darn. No, but I wanted to spend a few minutes just going through the Bible, the CNA Bible, to review for you, to remind you of what the CNA proctor is going to be looking for. And this is really weird talking to a camera, and so forgive me if I'm making kind of weird faces because I'm not used to this, and I really don't like my picture taken. So the first thing we're going to talk about is hand washing. Remember not to lean against the counter, and remember to turn on the water and get it at a good temperature and get your hands wet before getting your soap. So you're going to make sure you do good friction after you get your soap on, doing the backs of your hands, in between your fingers, the side, your wrist, even your fingernails on each of your palms. 20 to 30 seconds. Push it closer to 30. That way you make sure you cover the full time that they want you to do that for. Remember, the very first time you walk in the room, you are going to be assessed on this, so you need to be very careful on the very first time. Also, make sure you dry your hands thoroughly, drop the paper towel in the trash can, and then get a clean paper towel and turn off your faucet. Be careful not to reuse that paper towel to kind of finish wiping your hand, because I've seen some do that. Okay, so make sure you've got your hand washing down. That should be an easy pass. The next thing is your indirect care. Remember that they're going to be watching every time. Did you knock? Did you come in? Did you go straight to the sink and say, if it's not your first skill, you can say, I would wash my hands. And then approach the patient. Ask them how they're doing. Make sure you've said their name. Make sure you say your name and your credentials. I'm Dawn. I'll be your aide today. They also want you to use a new name every time, so it's not Mrs. Jones every time. It's a new patient. But don't get caught up in that. Just make sure you tell them, explain what you're going to do, and ask them if that's all right, and then tell them, I'll go get my supplies and I'll be right back. Okay? And then when you come back in, you can get everything set up. Don't be afraid to make more than one trip. Just think it through logically. If you have to stop and pause for a minute, that's okay. Look at your card. If you're thinking you're going to turn somebody, let's do change in position, make sure you double check that card that there's not a side you're supposed to put them on. Okay? Make sure you leave your bed in a low position. Give them a call light. Make sure that you follow all those things we've been talking about in your indirect care. Okay, the next skill in your CNA Bible is ambulate using a transfer gait belt. If you have your own, you can bring it. She has in the past let people use their own. So if you're comfortable with the gait belt you have, that would be fine. What they're going to watch for here is that you make sure they have shoes on their feet, okay, before you get them stood up. Get the gait belt around them. Be careful not to get anything pinched in that. And then I have them scoot kind of to the edge of the chair so that when you go to stand them up, it's much easier. Tell them every step of the way what you're doing. I'm going to reach behind you. I'm going to have my hands underneath your gait belt, underhanded like this, so that the gait belt can't slip through. Okay, so it's always underhanded. And then you're going to have them put their arms on yours, and on the count of 3, we're going to stand. 1, 2, 3, stand. Now, once you stand up, what are you going to ask them right away? Are you dizzy? Right. So then you're going to go ahead and start walking, and you're going to take 10 steps. So if you go in a circle, or if you take 5 steps out, then 5 steps back in. When you get back to the chair, you're going to ask them to, turn, never letting go of that gait belt, and ask them if they feel the chair on the back of their legs. All right? Once they do that, again, same thing as you did when you stood, you're going to hold that gait belt and tell them where to place their hands, and on the count of 3. They are also going to make sure that you ask them if their hips are back in the chair. Okay? So make sure they scoot back and that they're comfortable. Take the gait belt off and you will be good. All right. Next skill is assisting a resident needing to use a bedpan. A little more tricky, but it's easy. The only thing you're going to really need for the skill is to bring in a pad and some gloves, or the gloves are above the bed, so you won't have to worry about that. But bring in or come in with your pad when you gather your supplies. I set the head of the bed, or no, not this one, sorry, think and transfer. What I'm going to do is not raise the bed on this one. I think we've discussed it's easier just to leave the bed in the lowest position because you don't have time to raise, lower, all that. So go ahead and tell them that you need them to lift up, make sure they're flat, lift up their buttocks, put the pad under them, and then reach below on the bedside table, get out the bedpan. Remember, we don't take that out until we're ready to use it because we have a tendency to set it down on things that we shouldn't. So place that under them, make sure it's back far enough, go ahead and raise the head of their bed. Remember, when you're the patient, you can't say I'm uncomfortable or it's sliding, you can't say any of that. So you're just going to have to try to stay on it as much as you can. And then once you get them on it, go ahead and raise that head, hand them the toilet paper, make sure they have their call light, and step out. And while you step out, you're going to remove your gloves, wash your hands, get a wet paper towel or washcloth, and then you're going to come back in, hand in the wet paper towel or washcloth, put on some fresh gloves, and then you would go ahead or you can just tell the proctor, I would wash my hands here and put on clean gloves. And then you're going to go back in, hand on the paper towel, lay their bed flat, ask them to lift up, pull out the bedpan and the pad, put the pad over the bedpan, reach around the curtain, and set it on your bedside commode, which will be right around the curtain. And then you can take their cloth and throw it away or put it in the hamper, whatever you gave them, and then ask them if they'd like to sit back up or lay down. Make them comfortable, make sure they want their TV on or reading material, just make sure they're comfortable, they have their call light, put the toilet paper away. And one thing I did forget is you ask them if they need assistance with wiping, which we know they don't, but just ask them. And then go ahead and make sure the bed's all lower, everything's good, go ahead and walk out and go take care of your bedpan. Now, where's that going to be dumped? Bedside commode. If we put water in it and rinse it, it's going to be dumped in the bedside commode. We never dump it in the sink. We throw all our paper away. Pads will go in the trash that day, and wash your hands. Okay? That's that skill. Next one, changing bed linen while resident remains in bed. After you've done all your indirect care, you're going to tell the patient you're going to go gather their supplies. You're going to collect some items. What will they be? Yes, it will be a bottom sheet, a top sheet, a pillowcase, and then your towel. Remember, your towel is your barrier. Go over to the table, lay your towel down, and then you're going to flip your bed linens. You don't need gloves for this, but you can go ahead and raise the bed up, get your patient rolled over onto their side, but not hanging off the edge of the bed. Keep them covered, not exposed, but have the blankets up so they don't get tangled up in rolling into them. Then undo one side of your sheet, lay your clean sheet down, roll the clean sheet under the dirty. Make sure that's tucked pretty darn well. So if you're a patient, remember to remain on the side. Then go ahead and have them roll back, and then come on the other side, pull out the dirty, roll it up, put it in the hamper, pull the the clean one out, and then once you get those tucked away under the mattress, go ahead and lay the patient back on their back, and then you can go ahead and have them hold the clean top sheet while you're pulling the dirty one down, and then change their pillowcase. And that's it. Lower the bed, make sure they're comfortable, they have their call light. Change in a resident's position. Remember, it'll say change in resident's position. It's not going to say sideline position. You're going to need 3 pillows. Just make sure you do the correct side if they give you one. So you're going to have them roll onto their side, and one pillow is going to go firm, tucked under their back, and one between their knee and their ankle on their legs, and the other one kind of is their arm to rest on, kind of a hugging pillow. And so you do that all underneath the sheet. Make sure they're nice and comfy. I roll them back just a little bit to get off that hip there that they're laying on. And lower the bed, make sure they have their call light, and remember to always wash your hand at the end. Don't forget to be pulling your privacy curtain in all these skills, okay? Dressing a resident who has a weak arm. I think the main thing you want to remember here is strip strong, dress weak. Okay, so if they have a left side paralysis and you're taking off their gown, which side are you going to take off first? Strip strong, dress weak. Strip with the strong, and then dress with the weak. Okay, you can start at the feet like I do with socks and then pants and then shirt, or you can start at the top and work your way down. It does not matter as long as you're not exposing them. I do like to set the head of the bed up when I get to their shirt. So if you're going to do the shirt first, then you're going to have to lay them back down to get the pants up. That's kind of why I go backwards too. Let's get their feet, their socks, then I can set them up, get their shirt done, and leave them sitting up if they'd like. Okay? Just keeping them from being exposed and undoing the, stripping the right arm first and redressing the right arm, the correct arm first. Okay, emptying contents of resident's urinary drainage bag and measuring and recording the output on the intake and output form. This is one of your measurable skills, so you've got to remember you're going to chart and you're going to hand it in. So you're going to need a few things for this. You're going to need a graduate, you're going to need a paper towel, an alcohol pad, and your gloves. So you're going to go raise the bed up. It'll be on that far bed by the outside door. Raise up the bed, and you're going to put your paper towel down, your graduate down. I like to put my alcohol pad in my pinky. Go ahead and put the graduate under, open it up, drain it, click it closed, grab my alcohol pad out, wipe the tip, put it back on. And then I like to grab it and stand and lower the bed, make sure they still have their call light, and then tell them I'm going to go measure this and I'll be right back. When I get over to the counter, pull a new paper towel down, put it down, put the graduate on it, throw everything else away. I'm going to take off my gloves and wash my hands. And then I'm going to look at it, get down on eye level and look. And then I'm going to record it. As soon as I'm done recording it, I would have washed my hands and then record it, then hand it in. Okay, so make sure you wash your hands, record it, then hand in that paper, then put on gloves. And where's that going to be emptied? It's urine in the bedside commode, never in the sink. Okay, rinse it out, spray it in the bedside commode, and then dry it and put it all away. Then wash your hands. And you can contend with the patient and then wash your hands. Okay, so make sure you've got that all squared away. If you did not turn in your sheet, you will fail. Okay, you have to turn in that sheet. Feeding a resident who is sitting in a chair, again, you will have this be a measurable skill. You're going to have a tray. That will be your barrier. You're going to have your snack. Offer them, whatever's out there, pudding, applesauce, a spoon. You're going to want a napkin to wipe their face, and you're also going to want a cloth to wash their hands, and a clothing protector, and a cup and a straw with some water. And then you'll take that out to them after you've done all your indirect care, of course, wash their hands and ask them what they wanted. Bring that tray out, set it down, ask them to sit up straight in their chair, because they're going to want to make sure they're not going to choke. Even if they look like they're straight, ask them to sit up straight. Say, can I wash your hand? Offer to wash their hands, offer them a clothing protector, and start feeding them. You can offer them a drink first, a few bites, bites, whatever. Once they say they're full, you're supposed to encourage them. They're watching for you to encourage them. How about one more bite for me? Now, they might not take it, but I'd encourage them a couple times, okay? Offer them another drink, wash their face, make sure their face is clean, their hands are clean, and then clean up your stuff. Okay? Let's see. The next one is measure. Oh, and then you got to record that. Make sure you don't forget to record how much they ate and drank, and hand that into the proctor. And I would do that like right after they're done, because the proctor's gonna want to look at how much they ate. Okay. Measure and record a resident's radial pulse. They'll be sitting in the bed. For this, you're just going to come in time. You're going to do their vital signs. I would just say vital signs, even if it was pulse or respiration. Raise the bed so you're not bending over and having to, try to get it. Just raise the bed to a comfortable level. Pulse, again, is on the thumb side, so always make sure you're feeling the pulse in the right direction so that she knows you know what you're doing. Wait till the clock gets on, whatever's convenient for you. If you like the 12 or the 6, and you're going to say start, go ahead and count it, and then you say stop. Okay, now if you're pretty confident, you can just write that number down. If you're not sure you got it and you want to try it again, or you lost it at any point, then stop and say I need to start over. You have 3 tries. Okay, but whatever try you keep is the one you got to document on. Then write it down, hand it in, wash your hands, and you're good. Okay. Respiration's the same way. Make sure that you tell them you're doing their vital signs. You're not going to let them know you're doing respiration. Make sure you do it for a full minute. Chart it down. If you're not sure that you got it, go ahead and ask if you can do it again. You can, like I said, you can do it up to 3 times. Go ahead and record it and turn it in. Okay? Wash your hands when you're all done. Providing catheter care to a female who has an indwelling catheter. You're going to do all your indirect care, go get your supplies, come back, and set up. You're going to need how many pads for this one? 1 for a catheter, because you're only going to take care of the front. So you're going to put the pad underneath them so you don't get their bed wet. And of course, you would have your water and everything set up. You're going to have 2 washcloths, a towel, 2 towels, a barrier, and a dry towel, soap. No lotion on this one. And then you're going to ask them if the temperature of the water is okay on their leg. And then you're going to soap up your, washcloth or whatever after you ask them, or you can soap it up and then ask them. You're going to wipe down one side, turn the washcloth over, wipe down the other, turn it inside out, move the catheter around, over a little bit, wipe down the middle, hold the catheter, and on the other side, wipe it 4 to 6 inches. Then the same thing with rinse down the middle, rinse the tubing, pat dry, pull the pad out, put their legs down. And don't forget your bath blanket, okay? Worst case scenario, you do forget and you don't want to go get one, just use their sheet and pull it back, and then you have to tuck it and miter it. Just get a bath blanket, it's easier. Okay, make sure you wash your hands. Make sure the patient's left comfortable, you pulled your curtain, giving them privacy and so on. Okay, foot care to a resident who's sitting in a chair, pretty easy. You're going to need 3 towels, 2 washcloths, soap, lotion, gloves, towel for you for you to kneel on, towel for the basin to be set on. Make sure you take off their shoe and sock, soak it, make sure the tub's the long way, get their foot in there, let it soak. Get your washcloth, get it soapy, and hold their foot over the basin and wash it really good. Wash in between the toes. Then get your rinse one, and I'd wring it over it and rinse it off. Make sure all that soap's off. Move everything to the side. Dry it really good in between the toes, and then apply lotion. But where does the lotion go? Only on the tops and the bottoms, not between the toes at all. Okay? And then make sure you put their shoe and sock back on. Pretty easy. Okay, providing mouth care to somebody who has dentures. You're going to set up on the bedside table. You need a towel. You need actually 2 towels, 2 washcloths, toothpaste, toothbrush, dentures, a cup with a straw, an emesis basin for spitting in, and you need a little toothette, a little sponge tip applicator. Once you set it all up, you're going to take your dentures and toothbrush and toothpaste and a pair of gloves. You're going to go over to the sink, go ahead and put everything down on a paper towel. Take the lid off the dentures, and then you're going to, what are you going to do? Okay, you're going to turn the water on, get it at a good temperature, and the toothpaste on the toothbrush, then take one denture out. Of course, you have gloves on. Oh, you're going to lay something in the bottom of the sink. A washcloth. Right. So don't forget your washcloth, like I just did. Okay, scrub a denture, lay it on the lid, take the other denture, scrub it, lay it on the lid, rinse out the denture cup, put water in it, put the dentures back in it, seal it up, clean up your mess. If you take out that washcloth and throw it in the hamper, then make sure you wash your hands really good and dry them, and then come back over to the patient, ask them where they want their dentures. They'll tell you in their bedside table, put them away, put their toothbrush with it. The toothbrush stays with the dentures. And then you're going to start on the patient. So you're going to put some clean gloves on, raise the bed, clothing protector, and then you're going to take that toothette and put toothpaste on it, get it wet, and you're going to sponge their teeth, but it'll pretend it's their gums, okay? Because they don't have teeth, they have dentures. So you're going to pretend that they have no teeth, and you're doing their dentures. All right. So then after that, after you've done doing the denture cleaning completely, you wipe off their mouth with the washcloth, and then you're going to go ahead and clean up everything, okay? Make sure you offer them a drink in between each section. All right, so if you're going to do somebody with teeth, you're going to do almost the same exact thing, except you don't have to go to the sink and do the dentures. You're just going to set up everything right on the table, and you won't need the sponge because you're going to actually have a toothbrush, put toothpaste on it, wet it, and then start brushing their teeth in a circular motion, holding it at about a 45-degree angle. Okay, each section, I would do a section at a time, and then I would offer them a drink. All right, providing perineal care to a female resident. You're going to need 2 pads, 2 towels, 2 washcloths, soap, bath blanket, and of course you're going to come in, put the bath blanket on them, close your curtain, all your indirect care always. pad underneath them, and then you're going to, you have your water and everything. So you're going to wash down one side, wash down the other, wash down the middle, then you're going to rinse, 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 pat dry. And then you're going to roll them over and you're going to wipe up the crack. Remember we was right, wipe clean to dirty. So in the front, we're going to wipe downward, one stroke. Turn it over, one stroke. Don't do this. Don't go like pretend this is what we're washing. No, one side, turn it over, other side, turn it around, back side, okay? So you're just going to wash, 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 and then rinse, 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 and dry. And then turn them over, go ahead and do their buttocks, up the crack, each side, and then the middle, and then pat dry. Wash, rinse, dry. All right, always in the same order for everything. Then while they're over, you can change that pad under, roll them back, take the pad out, fix the pad, pull up their sheet, take off everything, and you're good. Okay? Doesn't seem so hard now, does it? Compared to that first day when we looked at everything. Just think logically what we've been doing all along. You're just showing them that you're competent to go to work. And I know you're competent. Nerves are going to get the best of you, but you'll be fine. Just think positive, okay? All right, hand and nail care, pretty simple. You're going to have two towels, 2 washcloths, a basin for soaking, soap and lotion. You're going to have an orange stick, and you're going to have a nail file. You don't have to wear gloves in the skill only because you will be in here with each other. Remember to get your warm water and then put that towel under their arm. It really acts as a support when you're supporting their arm with the towel, and that way you don't have to continually hold it. Soak it. You only do one hand. Once you're done soaking, you can go ahead and wash it. If you want to get your washcloths wet at the sink while they're soaking, you can. Or you can try to do it in the basin. It's just hard. Okay? Soap up your washcloth, wash their hand really good in between the fingers, then rinse it, and then take their towel out from underneath them, dry their hand, and then go ahead and support it again. Then what you're going to do is take the orange stick or the file. It doesn't matter which one you use next. If you're going to file, go ahead and file, and then use the orange stick, or you can use the orange stick first. But when you use the orange stick, you're going to go up under each nail, just with like a little stick. And like this is my stick, and I would go up underneath each nail, and then I'm going to wipe it under each nail and wipe it, okay? They want to see you doing that. They're going to be looking for that. And then they're also going to make sure you file and make sure they're smooth. If they don't have nails, just pretend to be filing it, making it smooth. And then get some lotion afterwards and rub lotion all over, okay? And then wipe off the excess lotion. And you're good. Then clean up. All right. Partial bed bath with back rub. You need 4 towels, 2 washcloths, basin, soap, lotion, bath blanket, and a clean gown. Get everything all set up. Then go get your water. Then raise your bed. Put the bath blanket on. And then after you get the bath blanket on, I'd place your towels in the right places. We're going to put an extra towel across the chest. We're going to put 1 towel down the side we're working on to keep the bed from getting wet. 1 towel's our barrier and 1 towel's for drying. Okay, so gloves are fine. Go ahead and get 1 soapy. Oh, well, first, no, we're not going to get 1 soapy. Take that back. We're doing face. Very first thing we're going to do is the eyes. We're going to wipe the center and out. Center and out. Okay, and then we're going to ask them if they want soap on their face. Of course, mine always says no. You know that. So they're going to tell me no. I'm going to wash their face and dry it. Okay, and of course, before I started all this, what do I want to do about the water? Ask them about the temperature. Good. And then after I've gotten the face done, I'm going to move to the neck. That's where I start the soap. I'm going to wash the neck really good with soap, rinse it, and dry it. Then I'm going to do the chest, wash, rinse, dry. Then I'm going to go to the abdomen, wash, rinse, dry. Then I'm going to do the arm closest to where you're working, wash, rinse, dry. You know, make sure you do the hands and the pits really good. And then after that, I'm going to roll them and go ahead and keep the towel there so you keep the bed dry. I'm going to wash, rinse, and dry the back. And then I'm going to do my massage on the patient. I'm going to get my lotion and worm it. And I'm going to go up and down and up and down 3 times. Then I'm going to do the circular up and the circular down. Circular up, circular down. Then I'm going to go circular up, circular down. Okay? And then I'm going to do the last one, which is circular up, circular down, all the way to that gluteal area and back up. Circular up, circular down, and all the way to that gluteal area. 3 times. Then I'm going to wipe off the excess lotion, roll them back, get their clean gown on them, get that wet one off, and pull up their sheet, and make sure the bed's all tucked away, tucked good and nice, and lower the bed and clean out my mess. Okay, a little longer, but it's not hard. Just think all the way down. Nice, easy motion. Asking them all the time, is water temperature still good? Are you okay? That sort of thing. And then we have range of motion on the elbow and wrist. Raise the bed for this so you're at a comfortable working level. Always support the joint, you're opposite of what you're exercising. And the elbow, we're going to just bring it forward and bring it down, and bring it forward and bring it down 3 times. And of course, I'd be one hand here and one hand here. 1. Does that feel okay? Any discomfort? 2, 3. No, it feels good. Okay, now we're going to do your wrist, back, hyperflex and extend. 3. All right. Any pain? No? Good. Okay, that's one range of motion. Then lower the bed, make sure they're comfortable. And I would ask them, if at any time it hurts during this, I want you to let me know. I'll also be asking you. Okay, for the shoulder, you're going to do it 3 times. Raise their hand up above their head, and you're going to support it above and up here. 1, 2, 3. And then the other one you're going to do is reason it out like 1, 2, 3. Now remember, they'll be laying in bed, and so you're going to have to bring it out from beside them, like they're waving, okay? So you're going to do that 3 times. And then the last range of motion is the hip, knee, and ankle. And on that one, it's like you're going to bring their hip and knee and ankle all up, at one smooth motion. And I can't show you really well in here, but you're going to bring it up and then back down. And that will be their hip and knee in one motion. And then their ankle is going to come up, toes towards their nose and back down towards the floor 3 times. That's dorsiflex and plantar flex. Okay? And so you're going to do those. Then we have transfer resident from bed to the wheelchair. Again, the only thing you're going to need is your gait belt. Okay? And this is the one where I like to raise the head of the bed and make sure their shoes are on and let their blood pressure acclimate, because you're going from laying down to standing up. But we got to do it in little sections so that we can raise their, not let their blood pressure drop and raise their head little by little. So I have them laying down, then I set their head up, ask them how they're feeling. And then I tell them, okay, from here, we're going to go ahead, put one arm behind the shoulder, one arm under your legs, and I'm going to have you push down on the bed, and I'm going to help you turn off the side of the bed, okay? Make sure their shoes are on. Go ahead and do that. And then once they're sitting up, ask them how they're feeling. And then go ahead and get their gait belt on them. And then I pull my wheelchair in. Make sure it's close enough to grab, but not too close that you're going to hit it when you get them up. Okay, you want to just be able to stand in front of them and kind of reach for it and grab it and pull it in. Because if you walk away from them, they could fall. And you don't want that. So go ahead but you don't want too close, because you could swing and hit their feet on it. So, got to make sure it's close, and then I move the leg pegs out of the way or take them off and have it really close so there's only room to just pivot and sit. I'm going to do the same thing I did when I ambulated. I'm going to go ahead and reach behind them, tell them what we're going to do, tell them where to put their hands, but tell them when I get them up, I want to see them grab for that far chair rail and help get in the seat. Okay, 1, 2, 3, stand, turn, sit. And then after you do that, make sure, ask them if their hips are back, take off the gait belt, and put their foot pegs on, turn them back in, and hand them their call light, and walk their brakes. And then wash your hands. Of course, always wash your hands after every skill. So remember to draw your privacy curtain. Remember to wash your hands, beginning and ending, even if you're not sure if you've done it. Do not forget to wash your hands at the end of vital signs, because a lot of people say, oh, okay, here's my paper, I'm done. Don't be so quick to tell the proctor you're done. Make sure you've thought of everything. Think about beginning and ending. Did I start with washing my hands? Did I end with washing my hands? If you think of something that you didn't do, tell her. If you haven't finished the skill, say, I would have, so she knows you would have caught yourself, okay? So make sure that you have everything, all your indirect care down, knocking, introducing, saying who you are, saying their last name, to let them know what you're going to do. Go get your supplies, drawing the curtain, raising the bed, lowering the bed, opening the curtain, washing your hands at the end. If it's a charting one, you chart. Just think logically. Try not to go, oh my gosh, dental care, I can't think. I don't know what to do. Well, just think. If it was your best friend sitting there and they needed your help wash their dentures. What are you going to do for them? Okay, so try not to think about it as a test. Think about logically. A lot of you have been at work. Remember, what we are doing in state testing is probably different than what you're doing in the real world. Not that it's wrong, but just remember what they're looking for. Okay, I wish you all the best luck. I wish you could have been here with us today, but we're going to go ahead and do a review here soon, and I'm going to send this out so that you can review it yourself, and you can do it again maybe the night before the test. I know it's a bit long. I think we're up to 30 minutes, 20 minutes. I can't read that. But I really would like, 30 minutes. I'd really like you to take the 30 minutes to just go over this and review, read your Bible, practice some study questions out of your book. But if you were getting decent grades on your test the whole class, you should do fine. All right, I will see you the day of your testing, and God bless. I hope you're all doing well.